Welcome everybody to the ADHS Town Hall meeting on boosters. My name is Dave Vopel. I'm CEO for Arizona Healthcare Association. Pam, would you like to jump on here real quick?
Yes, thank you. Pam Kester, CEO for Arizona Leading Age.
And on behalf of both of our associations and HSAG and ADHS, we want to thank all of you for joining us today. And we know these are tough times. We really appreciate everything that you're doing in long-term care. We know it's a struggle with staffing the way it's gone on, and just with the way the pandemic has just kept going on and on and on. And we truly appreciate everything that you're doing. It's because of your compassion and your skill that really long-term care still is those residents are still doing okay. And we want to thank you. You know, we want to have this meeting for a couple of different reasons. I mean, the main reason is because we need to increase our booster uptake in this state. We are last in the country for boosters. The last report that I looked at, which I believe was the January 2nd report, we stood at about 40.6% on the uptake for resident boosters. And we've got a great team here from ADHS, and we'll go through and talk with some of them here throughout the next hour or so, and have a little Q&A. So feel free to throw your questions in the chat, and we can get to those as time allows. First up, though, we are honored to have Dr. Carmona on the line here. And Dr. Carmona, as you all know, was the 17th Surgeon General of the United States, appointed by George W. Bush. And now he is the special advisor to Governor Ducey regarding all of this fun stuff with ADHS. So fun being a relative term, of course. So Doctor, I'm going to just turn it right over to you.
Well, thanks so much. It's a privilege to be with you and Pam and the rest of the team that's on here. We're thrilled to have the opportunity to engage with you because, you know, we have a common value proposition, you know, and we initially were very happy to see the surge of seniors getting vaccinated in the state. But, you know, we've also dropped off with boosters, as you say, especially in long-term facilities. So we recognize that you all are really the experts in that area, and everything we can do to help you to enhance the booster vaccinations are important for a whole host of reasons. As you know, the boosters help to prevent severe disease. And even with Omicron running around now, the boosters give you added immunity. So it's a way to, you know, basically prevent you from getting very sick. We've had some people that confuse the issues in the media and some of the social media, but the fact is, it's irrefutable that if you get your booster, it's giving you additional protection. Even if you got the disease, it's going to not be as bad. You're probably not going to be in the hospital. You're probably not going to be in the ventilator, and you're not going to die. I mean, so there's every reason to get it, because the downside of the booster is maybe your arm will be a little sore. You know, maybe you'll feel crummy for a few hours. But when you consider the immense value that it's giving you, and that people unvaccinated have up to 30 times more chance of dying, it really makes sense to do this. And we're talking about people 65 and older, you know, and certainly selfishly, I'm in that category too. So I think it's important for me to speak to the seniors in the community as well, to let them know how important this is, because besides being vaccinated, it's important that for those of us are at a higher risk, and it's not just age, but it's just with age, it's not uncommon that people might have some weight problems, people have hypertension, people have their lipids up, they may have diabetes. All of those things present a problem to you because they make you at increased risk, and your immune system isn't working as well. So one of the things we try and emphasize as well is, where there's increased risk, do everything you can to decrease your exposure. Make sure you're only around people that are fully vaccinated. Make sure that they're providing you with all of the opportunities to mitigate the extent of the disease in whatever long-term facility that you happen to be in. In the last few weeks, months, we've had some, besides vaccinations, we've had an improvement of our toolbox. So now we have not only the COVID vaccines and the boosters, but we have monoclonal antibodies, we have antivirals, and all of those, the practitioners know how best to use them. But what the monoclonals do is give you an extra boost in immunity, and it helps you. And certain people who would be at risk if disease progressed, monoclonal may prevent that from happening. The antivirals, if given early, could make a disease that might be serious into one that's not anything more than a common cold, feeling like that. So all of those things are important. And as these new drugs come out, the antivirals, the monoclonals, I know our team at Arizona Department of Health Services is staying very close to the long-term care facilities because that's largely where our highest risk is within the state. So I know some of my colleagues at AZDHS will be on here and answering questions as well. I think that there are some myths that need to be dispelled also. You know, people say, well, Omicron isn't so bad. You know, it spreads fast, but it really isn't as bad as hurting you, for instance. Well, no, that's not true, because especially in the population we're speaking about, even Omicron, which may be a little less of a challenge disease-wise, spreads faster. And if you have chronic diseases and you're older, it can kill you. So every reason to get the vaccine. In addition, people say, well, I've already had it, so I'm safe. No, not really, because those antibodies don't last that long. And even if you think you've had the disease, even if you were tested and had it, get the vaccine and get the boosters, because it will give you even more opportunities to stay healthy. And should you be re-exposed and have a breakthrough infection, statistically, it will be milder and not put you at a hospital on a ventilator and prevent death as well. So you'll hear a little bit about the supply we have of the monoclonals and antivirals. We have various teammates at Arizona Department of Health Services who have responsibilities for all of these issues. But as was said when we opened up, you know, I've been with them for a few months now, and these folks are really working tirelessly. They are doing everything they possibly can to reach every vulnerable population and get information out to everybody, seniors as well as children, where we've fallen behind a little bit in vaccinations. Every person who gets vaccinated not only helps themselves and their family, but helps to create herd immunity to eradicate this disease spreading in our community and make it what's called endemic, that it'll be there. It'll be like other viruses like the flu. But my colleagues in Washington and around the nation now and the world are studying how we would include coronavirus into the normal flu vaccine in the future, so we won't have to worry about this. So for those of us who are old enough to remember polio, I will just remind you, think about when we were children and our parents were worried about us ending up in an iron lung or being paralyzed and dying. There was no divisiveness there. Moms and dads took our kids out and they got the Sabin or Salk vaccine right away. And today, you don't hear about polio anymore because there's no place for the virus to go. We didn't allow it to continue to create variants, mutations and variants, because it can't get into anybody and live in that person's body. So pretty much the world is free of polio, except for a few rare cases in underdeveloped countries. And that's what we're trying to do here with this. Make this impossible for the virus to replicate and continue to harm by making new variants that can cause problems. So my plea to all of you, as a fellow senior, as a Surgeon General, as the advisor to AZDHS and the governor on these issues, please get your vaccines and get boosted. It's the best thing you can do to help yourself and help all of us in the community put this behind us. I'll turn the floor back over. Thank you for the opportunity.
Thank you. We really appreciate those thoughts. You know, part of the issue too is with the seniors that are being served in long-term care facilities. You know, they might have a little bit of apprehension about those having those shots, and I think your comments hit home for most of those as well. So up next is Colby Bauer. Most of you know Colby. He's the ADHS Assistant Director for Public Health Licensing. Colby, take it away.
Hi, thanks, Dave. This is Colby Bauer. Thank you for the introduction. I'm the Assistant Director for Public Health Licensing here at the department. And I just want to kick off by saying, Dave, to you and Pam specifically, what great partners you've been through this whole pandemic. You know, your association, your leadership has been critical. Whenever we've needed anything, you guys have always stepped up. And so that's the type of partnership that gets us through these difficult times. So I do want to thank you, not only personally, but on behalf of the department. And I do also want to, Dave, echo what you said. I think we all recognize the tremendous pressure that facilities are under, both from, you know, we experience it here too, you know, getting that message out to staff to get vaccinated, getting that message out to residents can even be more difficult. But it really is the leadership within each facility that is so important to keep pushing to get those vaccines out, get those boosters. That's how we are, as Dr. Carmona said, that's how we're really going to impact, the terrible burden that this disease has brought, particularly amongst our elder population. So I do want to acknowledge the difficulty that you guys are having. But moving forward, we also want to extend, and Dave and Pam, we've had these conversations before. We want to extend out to all the facilities that if you are running into a particular issue, whether that's logistical, not able to get boosters scheduled at your facility, if you need any assistance whatsoever, please do not be shy. Reach out to either Pam or Dave if you're a member of the associations, or the department directly, and just say, we need help. We want to get some boosters. We need a vaccination event at our facility, or whatever that might look like. We will help. This is a priority for the department. As Dr. Carmona said, the residents here are most at risk for severe disease, and we want to do everything we can. So do not be shy. It is difficult in the best of times. And so we know the strain you're under. So please raise your hand and ask for that help if you need it. And with that, I think that's all I've got to say. So with that, I'll kick it back over.
Okay, very good. Thanks, Colby. That's exactly right. Up next, we have Carla Berg, ADHS Chief Strategy Officer. She's going to talk a little bit about mobile clinics and some of the other resources that are available through ADHS. I know we've been adding this into our newsletters and our messaging from both associations for a few weeks now, but it'll be good to hear some of the nuts and bolts from you, Carla. To you.
Thank you, Dave. Yeah, so as mentioned, we are very much committed to increasing vaccinations throughout our communities, especially within residents and facilities. And we really want to support and identify where there may be gaps, and we can support with that. In the chat, you'll see that we'll be adding an azhealth.gov/LTC boosters. And there's a fact sheet in there about information, but it also provides some information about how you can reach out to us. We have a couple ways of connecting. In that link in that flyer, you'll see that we have an easy to complete online form where you can select the type of event that you want, if that's the need that's being requested, details on vaccination type, any request for ADA accommodations. You can also contact our vaccine equity coordinator directly, and her email is listed on there as well. She'll be the primary point of contact, and we really work to connect facilities with specific requests to a mobile vendor option. We have mobile vendor vaccinations that are available. We have statewide coverage. They're experienced in providing vaccines in a variety of settings. They're able to provide primary series, third dose, and boosters. And it can really be deployed to a variety of settings. And so we really want to help promote that and encourage requests to be made to ADHS. To date, I'm happy to share that our mobile vendors throughout the last 5 or so months that we've deployed with this option have reached over 57,000 vaccinations throughout the state and reaching communities where they are. So some of these are very specific community events, and that's what we would look to be able to provide for any of the facilities that you have in the requests that are coming through. Thank you.
So Carla, while you're on the line here, so a facility logs in, they check out the website, and they have to put in for a mobile vaccine clinic. What kind of timeline can they expect?
Sure. So you'll be receiving contact from our vaccine equity coordinator within 24 hours. And then we'll establish a virtual call or a Google Meet with the vendor and the facility shortly thereafter, as soon as scheduling provides. And we're just looking at least a week lead time, depending on the location and the facility. We might need a little bit more, but depending on that, probably 1 to 2 weeks lead would likely work with our mobile vendor contracting.
And I know we're talking boosters here, but if it comes down to the vaccine, you can include anybody in on that clinic, correct?
Correct. Yeah. So we can think through and identify staffing needs or any other opportunities that we have, not just the residents. So we can work through identifying what best fits the need and have some creativity there within the options that we can provide.
Do you think there'll be like a monthly option so that you could come back, or do you think there'll be anything added like that piece of it? or is this a one-time deal to where you know, like an emergency basis?
Sure. Again, we can kind of work through the facility needs if there are more recurring options for events that could be for follow-up. Let's say we do have a good amount of individuals that may need a primary dose, and then we can identify second doses or what other additional needs there are. We can definitely work through those and see if we can identify multiple events.
Great. All right. Very good. Thanks, Carla.
Thank you.
Appreciate it. Next up, we have Keith Chartier, Associate Director for Health Services Advisory Group. Now, most of you know HSHE. They've been great partners with us, both associations and with you all. And they're here to help out on the infection control side, with vaccinations, with boosters, all sorts of stuff. Keith, I'm just going to turn it right over to you.
Awesome. Thanks, Dave. And thanks for having me on this call as well to help just share what we're going to be doing as a QIO to help out everybody in Arizona. So just as a quick background, we are the Medicare Quality Innovation Network Quality Improvement Organization here in Arizona, and we are one of the largest federal programs dedicated to improving the health quality of Medicare beneficiaries. And throughout the pandemic, we've had staff working directly with nursing homes on outbreaks and increasing vaccinations among staff and residents. And last week, Medicare actually directed all of the QIOs nationwide to direct their focus on increasing the boosters in long-term care facilities. So this is just really good timing, and the serendipity is great, and the partnerships are great to help get this information out there. So I just want to explain a little bit about what you can expect from us over these next few weeks as we start putting our support out there. So starting this Friday and through April 1st, we're going to have a 30-minute Quickenar every single Friday at 12:30 p.m. And this is just really an opportunity to make sure that we're getting information out to you while also collecting questions and getting you answers on a weekly basis. It's basically an opportunity for a weekly forum around the booster initiative. And the way they're going to be structured is we'll have about 10 to 15 minutes of just a presentation on the latest information, a topic to help you out, and then we'll have experts on the line for an office hours to close it out. So we do have an infection preventionist from HSAG who's going to be on the line, and ADHS is also allowing us to have one of their immunization nurse educators that's going to join us, which is going to be great. So on that one pager that they linked out in the chat, there is a registration link in there, and I will put it in the chat as well myself, but you can register for every single session at once. And so we definitely highly recommend you doing that. Get it on your calendar so you don't have to worry about remembering when those sessions are going to be. And it may be a few weeks, but if you have a question, please join us on those sessions for that information. Another thing you can expect is just weekly email communication. We send this out a lot. We've already sent out information on these webinars that we're going to be doing, so please continue to look out for those. And the third big part is going to be direct assistance to the nursing home. So we are specifically looking at nursing homes with lower resident vaccine booster rates to start working with them. And we are currently hiring staff, building up our team, getting people to reach out directly one-on-one with everybody out there. So starting basically late last week throughout the next few weeks, please expect a call from one of our HSAG staff members. We want to check in to see how things are going with your nursing home boosters and see where their gaps are, see what barriers you might have, and see where we might be able to help you out. We don't want to, again, put too much pressure on you. We really want to be an extension of your work. So we know you're busy. We know you're on the front lines. We've heard a lot of administrators and DONs working at the bedside. So if we can help you out in any way, we want to do that. And so when a staff member does call you, we'll just go through a menu of options of things you can do, including signing up for a mobile clinic with ADHS, having an RN administer vaccines, marketing, getting posters, awareness of anything you need. We can also help coordinate with ADHS. So if you have multiple facilities that want to combine efforts, we can identify those opportunities with you. We can also help check your data with the National Healthcare Safety Network. We know a lot of times those data are not properly entered, so we want to make sure that's accurate. And we also can put you in contact with vaccine educators. So a lot of help on the horizon. So please just expect a call from one of our staff members, and we're just here to help you. We want to be an extension of all the great support you've heard on the line already with ADHS, ACA, and Leading Age. And I'll put the information in chat so you can reach out to us as well. So thanks, and Dave, back to you.
Thanks, Keith. Yeah, you guys are such a huge resource. I know we do a lot of partnering together, and whether it's vaccines and boosters and all that good, NISN and everything else, all the reporting. Is there like a one-stop shop? Can they go to your website and you have a I know you have a plethora of information on there, but is there one place that they can go to see just specifically what you're doing for long-term care?
Yeah, absolutely. So I put a link in the chat right now. It's a shortened link, the bit.ly link, and they can go right there. It's got all of our vaccine information. It's got the topics that we'll be covering for these Friday Quick-and-Rs, and everybody can sign up there as well. So we'll have all that information on our website. Any updates that we do get from CMS and CDC, we'll start putting up there as well.
Good. Excellent. Okay. Well, again, I'd echo what Keith is saying here, and that is if you need any help on that end, feel free to reach out to Keith and the team there at HSAG. They do a great job. You know, I want to mention that we also have Jessica Rigler. She's the Assistant Director for Public Health Preparedness. She's on this call, and I think Dr. Karen Lewis, ADHS Immunization Program Medical Director, are on the call, as is ADHS Interim Director Don Harrington. I'd like to thank all of them for joining us as well. Anything from Jessica or Dr. Lewis, or any comments regarding anything that's been talked about so far?
Hi, Dave. It's Jessica. Just my thanks for pulling all of this together. I'm available if there's questions from participants on the line, but I don't have anything to add at this time to what's already been said by my colleagues. Thank you.
Great. And didn't mean to put you on the spot there, Jessica, but you know, you're on the call, so why not? Very good. Any questions? I know there were a couple in the chat. Let's take a look at that and see what we've got happening here. Are these resources available for assisted living communities? That's one of the questions in the chat. Jessica, do you know that answer, or is that Carla? Can you answer that?
Yes, we can certainly coordinate with assisted livings as well. We're encompassing long-term care as an umbrella for skilled nursing and assisted living facilities. So happy to engage in that conversation to see how we might be able to provide support on the clinic side.
Excellent, excellent. Okay, let's see what else we have in the chat here. Yeah, so I think that's everything in the chat. Holy cow. Okay, any other questions? Throw them in the chat. Otherwise.
This is Karen Lewis. Just one comment. With the vaccination of the long-term care facilities, it should be all the mRNA vaccines, not Johnson & Johnson. The CDC prefers mRNA vaccine to Johnson & Johnson.
So it could be either Moderna or Pfizer is what you're saying.
Yes.
That's the follow-up.
Yes.
Gotcha. Okay.
There's only, except for rare exceptions, one of the two mRNA vaccines should be used.
Gotcha. So I know part of the hesitancy that we hear about from the membership is that, you know, we were a Moderna state when we went through all the clinics a year ago to get folks vaccinated. And there was a little bit of pain going on when the second vaccine came around, and older adults, they were just like, why do we need to get a third vaccination? Why do we need to get a booster shot? And I think that's one of the things the administrators and the staff in long-term care are really dealing with, is trying to figure out, okay, how do we convince people that that needs to be done? I know Dr. Carmona had some words of wisdom for us. Dr. Lewis, anything from your end regarding that?
Giving them the guidance and encouraging them that since the immunity wears off, the vaccine gives them the advantage of staying healthier and just lets their own immune system get boosted by the vaccine. But I understand that there could be resistance. It needs to be at least 5 months after their primary 2 doses. So there'll be a little issue with timing, but it's been so long since most of them have gotten their vaccines that shouldn't be a big problem.
Gotcha.
David,
So go
can
back to, oh yeah, go ahead, Dr.
Just
Carmona.
make a comment to what Karen said, and certainly I agree. I think part of the problem was thinking back to December of 19 when this started, and we were just learning about this virus. I mean, it was similar to other coronaviruses, but it had many, many differences. And I would say, being critical of all of us, my colleagues nationally, is that in the haste to get it out, we didn't tell people that this is a start. You know, we'll be coming back to you every week with information. You may need boosters. Think about your own children when you get your first booster series as they start, you know, after a couple of years. They get 2 or 3 shots going along. And so we know immunity doesn't last forever in a lot of diseases. So I think that's confused people, that they go, well, you told me to get it and I did. Now you're telling me I need another one. And the reason is that we didn't have any historical perspective to be able to say the immunity will last 6 months, a year, 2 years. And so I think we need to do a better job of communicating, and I understand some of the confusion, but the challenge was that we were really all learning this as we went along, because there was no specific scientific guidance that accumulated to have us make those statements prospectively. So I know when I speak a lot, I do spend a little time on the history so people understand, and I will reference the polio vaccines, the measles, the mumps, rubella, how children get many vaccines over years because immunity wanes. It doesn't stay forever. And this is just another virus that we're learning to deal with.
So Dr. Carmona, maybe, or Dr. Lewis, you could answer this. So if somebody had the Johnson & Johnson vaccine or they had the Moderna, you're advocating for the Moderna or Pfizer to come back, and that's after 5 months. Now, so if they had the Johnson & Johnson, it's okay to come back and do the mix and match, right?
Yes.
Okay.
Yes, absolutely.
Okay. Excellent.
I guess I would say to the, you know, again, this is a point of confusion that I know our colleagues at AZDHS have had to deal with, and myself personally, because people don't understand that really what you want is this bump in the immunologic response. Whichever of these vaccines you are getting will bump it up. So, you know, early on, it wasn't certain, but after it was looked at in the early research on thousands of patients, it was determined that, yes, we want an immune response, and you shouldn't delay it because you can't get Pfizer or Moderna. Get the one that's available. Remember when we first started getting vaccines in the beginning, I had people calling me and saying, well, which one should I get? What if they don't have that? Should I wait for the next one? I said, no. The best vaccine is the one you get in your arm today.
But not the Johnson & Johnson.
Well,
Just
the
to be
Johnson
clear.
& Johnson, again, historically, we found out there were some problems. And so they shied away from it, that when you can, it still is immunologically functional. But because of some of the things that popped up, if you have a choice, people have said, well, why not let's stick to the Pfizer and the Moderna, which are mRNA, as opposed to the other type of vaccine, which is the J&J.
Gotcha. Okay. All right. So if somebody receives the antibodies, how long should they wait for their booster?
So I'm happy to take it if anyone, Dr. Lewis or somebody else wants to. Or, so. Anyway, okay, so basically, I think the important thing to remember, if you've had your series and you're older, and you are at increased risk of progressing, and that if you progress, it could be really, really detrimental. That's where you're looking at the monoclonal antibodies. And of course, they are in an infusion over a couple of hours. And then it's essentially recreating what your body could do for you if you were exposed to the antigen again. And so if you have to, if you're going to get a booster, this is assuming you've had the booster already and you've got your 3 series. And now you get the monoclonal antibodies. There's no reason to think about getting another booster at that point. However, there is research accumulating that a 4th shot could be available. And if you look around the world, there are several countries that are advocating for that now, because they're finding even after the 3rd booster, in some cases, the immunity starts to drop off again. So don't deter getting the monoclonals if your provider tells you you're older, you're immunocompromised, you're at risk, get the monoclonal antibodies. Don't worry about the booster. Then deal with the booster after. If you've already had the booster and you're getting the monoclonal antibodies, then you're in line like everybody else, waiting to see, does the science suggest in our country that we're going to advocate for a 4th booster?
And I know there's a couple of other questions in the chat here. One of the last ones there was residents. Is it true that residents cannot decline the booster? They can decline though, correct?
Well, yes, I think again, this is a challenge all over the country, not just in long-term care, that people decide because I've had people tell me, well, I'm an American, you can't tell me what to do. And,
Sure.
And this is no different then again, I often use these examples and tell stories because they tend to be more real for people. I dealt with this as Surgeon General with smoking, where people would say, well, you can't tell me not to smoke. I'm an American. Yeah, but again, the issue really is in a democracy, what I call the perils of a democracy, the right of the individual versus the collective right of society. So you're smoking, you do have the right to smoke, but when you do and you get chronic diseases and you need healthcare for your emphysema or cancer later in life, we the people pay for that. If you're smoking in the smoke is in the environment, that secondhand smoke, it's not a nuisance, it's deadly. And the lady next to you who's pregnant may have problems with their pregnancy. The person who has cardiovascular disease is in effect getting that secondhand smoke. So these are the challenges that are, ripple through democracy all the time. I use the example of smoking because everybody remembers it, but it's the same issue with masks. It's the same issue with vaccines. It's the same issue with boosters, that individuals decline for whatever their reasons. We at the Arizona Department of Health Services have spent a significant amount of time looking at this idea of vaccine hesitancy, because one answer doesn't fit all. You have people that are scared. You have people that don't understand the science. You have people that are confused because so many messages are coming out. And then we look at culture. What about the migrant population? What about the migrant workers? What about the new immigrants? Different language, different cultures. So we've been looking how to best craft narratives to touch on all of these populations that there's a potential to move them to vaccination. And then you have people that are dug in ideologically, that they just don't want to be told what to do. And those will be the most difficult for us. But I can tell you, Director Harrington and Jessica and the rest of the team, these are questions we're talking about every single week, trying to figure out the best way to get narratives out to people that are health literate, culturally competent, to drive the behavioral change that will increase our vaccination rate and thusly our herd immunity.
Mm-hmm. So I'd like to do a little pivot here, if we could, and talk a little bit about the numbers. So of the Omicron, those that have had the virus, the Omicron variant, how many have had the booster? Do we know?
This is Jessica. At this time, we don't have the data broken out in that way. So I don't have an update on that. We do know that vaccines are highly effective at preventing infection, hospitalizations, and death due to COVID. And people are at significantly increased risk of becoming infected with COVID if they're unvaccinated compared to those who are up to date on their vaccines.
Gotcha. Okay. Very good. And I know that, again, to kind of turn things around a little bit, but the Supreme Court ruled, a week ago Friday, that said that CMS could mandate that healthcare professionals get the vaccine. And that's going to be starting February 14th. Arizona is now included in that. For some time, we were not included, and we were part of the injunction. But starting February 14th, everyone that's working in a healthcare facility, hospitals, long-term care, not assisted living, they will have to have their first round of vaccine. So then after that, the next date is March 15th. That facilities will have to meet. They'll have to have 90% of their folks either vaccinated, or they will have to have the medical or the religious exemptions in place. So I know you all at ADHS will be looking for that when you start doing annual surveys and things like that. So that was one of the questions to be asked or answered in the chat. Pima County Health Department's done a great job offering support, and the booster team did a great job in a timely fashion. So there's a shout out to Pima County. There was another idea in here regarding, short-term care or short-term patients. So we have a lot of rehab and short stay, I should say, patients in long-term care, especially here in Arizona. Patients that might come in just for, that might be in for 9 days or 11 days. And it's tough to get them the vaccine. Perhaps a community campaign focused on Medicare beneficiaries would be helpful to long-term care centers. So that's another idea that somebody's throwing out there. In fact, it was Amy Malkin. Amy, shout out to you. Thanks for the idea. Let's see.
Hey, David, what I would say, just for a moment on this, this aggregating of thoughts and questions really is very important, because I can tell you our colleagues at AZDHS struggle every day with the complexity of some of these issues. And often the concerned citizen, the concerned professional, like the ones on the call here, asking questions or giving us their best ideas and crowdsourcing information, we get a better solution. So I would encourage everybody listening, please continue to reach out, ask the questions. All of the leaders that you see here and others that aren't, they are very receptive. And I think this crowdsourcing is really an important tool for us to accelerate to important decisions when we are sure we have the best information.
Mhm. So I know we had talked about them. I'm going to screw this word up because I always do. Monoclonal infusions. There you go. Yeah, that word. If somebody's had the complete vaccine series and then they receive the monoclonal infusion, how long do they need to wait for the booster after that's done?
The question probably is if they've had the complete primary series.
Primary, correct.
Yes.
You know, still needing a booster. And then they come down with COVID, which can happen,
Right.
and get the monoclonal antibodies as treatment. Then they need to wait 90 days. Now, as we get into the grassroots of delivering vaccine to the long-term care facilities, there's going to be a lot of variables based on patients. The fortunate thing is CDC keeps updating a document called Interim Clinical Considerations for Use of COVID Vaccines Authorized or Approved in the United States.
Mhm.
And that's a document that whoever is going in to the care facilities will need to have as a reference to be able to take care of the individual questions, such as, oh, you know, I got COVID, I got diabetes, I'm afraid of getting a booster. What can you tell them? You can tell them that vaccines are better than getting COVID again, things like that, but that will be on a grassroots level.
Great points.
Yeah, so that there was something similar to that in the chat regarding a person who she's concerned that the boosters would have a problem or place a problem on her kidneys. She has diabetes, just like you said, and so I'm glad you answered that. That's right up there.
It should be noted that, if I might say, David, the opportunity of speaking some of these challenges, there's a lot of spurious information on social media that confuses people. We've heard about infertility. Young girls moms don't want to have young girls get it because they'll make them infertile. Men being, the sperm count will change. None of that's true. There's no information to that, but yet it gets out there, and then again, more confusion, and people don't know who to believe. So this is a real, I can't list all of them because there's so many of these spurious reports that are out there. But I think when it comes up, I would just encourage all of the listeners and the long-term care facility management teams, call somebody at ACDHS and they can give you the information, correctly. Dr. Lewis and others as well. Reach out to somebody who's known and respected and apolitical and will tell you the truth based on the best science up to that day, so that you can make the best informed decision.
Well, I know both the associations have regulatory folks on hand as well,
Yes.
so that can answer the questions too. So yeah, we're all available. So that's a very good point. So one of the questions in the chat was, are facilities able to have nurses administer vaccines? And from what I understand, as long as that RN is approved or goes through the paperwork with their pharmacy provider, that RN can then administer the vaccine. Is that correct?
Yes, I believe that's correct.
Absolutely. Yeah, as the nurse needs standing orders to be able to administer it. So the medical director for the facility would need to write standing orders, but then the nurse.
And then they'd have to fill out the paperwork from the pharmacy to be able to, and then they'd have to figure out with the pharmacy how to be able to get the vaccine and that type of thing too. So.
Or whether the pharmacy sends out people and then the pharmacy doesn't need standing orders, but a nurse would need standing orders.
Gotcha. Very good. Okay. Excellent. Well, I think that's all the questions in the chat that I can see. Scanning one more time here. Yeah. Well, Dr. Cremona, Dr. Lewis, any last thoughts on, we really appreciate you taking the time and doing this. I mean, this is huge. We know we have to get that number up from 40%. I mean, it's critical. And I'm hoping over the next 6 to 8 weeks, we see that number move up greatly and quickly. So any last words, any thoughts, any words of wisdom for long-term care providers here?
In
Louis, you want to
general,
go?
the older people who have had the greatest uptake in COVID vaccines. So hopefully the long-term care residents will want it in general. And it would be the workers at the long-term care facilities. They are going to have the requirement. So in one sense, things are weighted on being successful, but the efforts need to be taken just to take the logistical steps. And my motto is disease is bad, vaccines are good. Simple reply to people.
Very nice.
There you
Yeah.
go. Excellent.
I would just add, I'm glad that the government is weighed in on this. Of course, the challenge, of course, is you'll still have some people that are not going to want to do this. And there could be workforce challenges because of that people just refuse to get vaccinated. We hope that it's not the case, but historically that's been a problem, even when you try and impose it or provide incentives that for whatever the reason, good or bad, that, we have to anticipate. In a perfect world, we would hope that everybody would act as our parents did when we were children, when polio came around, get vaccinated. That's it. There's no divisiveness here. Every independent, Republican, Democrat, communist got online and got a vaccine, because you didn't want the disease. So I think that for me, the most important thing is that reaching out to our long-term community is, as you speak to your workers, as you speak to the people that we have the privilege to care for, those patients, if there's any concern, if they are not sure, if they read something that was spurious and they're not sure should they act on it, reach out to the team. Everybody there will help. We'll come out. We'll do another one of these. We'll talk to everybody. That's how important this is, because we have to accelerate herd immunity. If we don't, we'll get to herd immunity, but it will be very costly, both in lives, morbidity, and in cost.
Very good. Dr. Cremona, Dr. Lewis, Jessica, Colby, the whole entire team there at ADHS, thank you for jumping on this call with us. We really appreciate it. If any of you on this call, you didn't see the chat in time where we had these links in there, you want the links with Keith at HSAG, that type of thing, you can reach out to Pam or I, either one of the associations, or to ADHS directly to get any of those links. So you can follow up with questions as well. We can direct you to the right folks. So thank you all for taking part in this, and we really appreciate it. And let's go for boosters.
You bet. Thanks very much.
All right. Take care.
Bye-bye.
Bye.